I'd like to start the meeting. I believe we have a quorum.
Yes.
Have enough?
Yes,
Okay.
we do.
All right, let's say the Pledge of Allegiance, please. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Because I should say officially start the meeting. Okay, so do you want to review the meeting minutes, Marie, from last month? Should we do that, or do you want me to get ahead with the agenda? Okay, so we're going to rearrange the agenda a little bit, and I'm glad to see some public participation. So I'd like to have our guest speaker, Andrea Gilbert, the president of Bryn Mawr Hospital, come and speak about the new pavilion at Bryn Mawr Hospital. So welcome. Thank you so much for coming.
Thank you so much. It's a pleasure to be here. Let me just make sure I'm advancing these slides correctly. Okay, hold on here. Okay. So Linda asked for us to come and give you an update in terms of what's happening down the road. We've been busy. I'm sure you can sort of see from afar that the new construction has occurred. The new pavilion was, we broke ground in, I want to say, May of 2016. We finished construction in November of 2018, and we actually opened and are operating in the new pavilion just in February, thanks to the help of a lot of folks, and wanted to kind of quickly go over what we have in front of you. So just a real quick recap of the mainline health. Bryn Mawr has been part of the mainline health system. We're a system of 4 acute care, 5 hospitals altogether, been in existence since 1985. So our mission, just to review, is to provide a comprehensive range of safe, high-quality health services complemented by related educational and research activities. Not many people always remember that, but we do inside the walls of the hospital. To meet the healthcare needs and improve the quality of life of our community. Our vision is to offer superior experience for all of our stakeholders. That would be our patients, our employees, our physicians, and our community. And our values focus around patient safety, compassion, participation, innovation, excellence, integrity, communication, and diversity, respect, and inclusion. Just a quick overview of some of the high-level statistics for our health system. We're one of the largest employers in this Philadelphia region. The health system employs over 11,000 staff. We have over 2,000 physicians on the medical staffs of our hospitals. 2,000 staff, families and people volunteer their time. We couldn't do what we do without them. We're 1,355 licensed beds. In total, our ER visits, just under 200,000. We deliver 7,600 babies a year. Our outpatient visits are close to 1 million. And we have a very robust home care program that is now seeing over 245 visits, home care visits. So quickly then, Bryn Mawr Hospital. You see the picture of the campus on the left, the original campus, and the new pavilion on your right. We, Bryn Mawr, have 1,770 employees. Our discharges on an annual basis, just under 15,000. Our ER visits, which Linda knows well, just under 50,000 ER visits a year. We're licensed for 287 beds. We see about 250,000 outpatients. We performed about 9,600 operations. Last year, we delivered about 1,600 babies. And we train residents in medical and surgical residents from the academic centers downtown. And on the next slide, we outline some of our major teaching affiliations. But just to remind you, Bryn Mawr Hospital was founded in 1893. We celebrated our 125th year last year. We are a not-for-profit community teaching hospital, and we have a long tradition in the nursing area of really nursing excellence. We are a magnet hospital and a magnet health system. Our training programs extend. We have our own family medicine training program where we train residents we have about 16 family medicine residents. We train probably upwards of 40 surgical residents from Thomas Jefferson University in surgery, general surgery, orthopedic surgery, urology surgery. And we have many, many affiliations with many of the local nursing programs, primarily and strongly Villanova, but we also train our nurses from all across the region, Gwynedd Mercy, Drexel, Eastern, University of Pennsylvania, and on. The campus, just in terms of the facility, we've had a number of things happen on the campus. The most significant and historic is the building that I'll just briefly provide an overview, but it's a 256,000 square foot pavilion. It cost us $253 million, and I'll summarize what that looks like in just a minute. We are launching a Center for Integrative and Functional and Regenerative Medicine, and we hope to have that program up right after the first of the year. We have a economic joint venture relationship with surgeons to operate pretty much a dedicated orthopedic surgery center, and that is across from the ER in the new building on 135 South Bryn Mawr Avenue. We've done some investments in parking over the last several years. We've added some floors to the garage on Bryn Mawr Avenue. We've made lots of investments in our infrastructure, and we are currently finishing up some major changes in our lobby, which I'll show you in a minute. There's still some work that you'll see as you drive around the hospital. Probably will take us another 6 months to complete some of the external work on the Warden lobby entrance, which is the old Lancaster entrance of the hospital, which is our main entrance. So here you have a view of where the new building is. It's in the middle of the campus. We took down an old nursing dormitory called the Clothier Building. That came down a bunch of years ago, and in that center of the campus is where we constructed basically an 8-story building, including the penthouse, the mechanical unit, and then the basement on the ground floor. Those are the dates we mentioned. It's connected on almost all floors to the existing hospital. We've been able to accomplish some nice things. We have on stage, if you will, elevators, patient elevators, and public elevators. So we're now able to separate patients from public traffic, which was one of our primary goals. We also really took into account lots of natural light in this building. We tried to ensure that anywhere we could put windows and natural light into patient rooms, and just a very much more healing environment in this healthcare facility than anything we've been able to accomplish before. We have 2 green roofs. We're very proud of the fact that this building will be certified as at the silver level for LEED certification, which is an environmentally sustainable standard, both in terms of how it was constructed and the materials that were used. Just a quick overview on the right side where you see the black triangle, that is the Warden lobby entrance, and you get into the new pavilion by one of 2 ways. You can access it through the Warden lobby on the right. You walk down the corridor and into that big open sort of funny shaped space, which is the new building. You can also enter the new building through the ER entrance, or right off the ER is the blue corridor, which is the Bryn Mawr Avenue entrance, and it will also take you into the new atrium, if you will, of the new building. So what's in the building? Ground floor is where we've located all of our operating rooms. So we closed the old operating rooms and we created a whole new surgical suite on the ground floor. We have a capability of running 13 ORs. We are currently operating 12 of them. They are truly state-of-the-art facilities. They are 650 square feet a room, capable of supporting all of the modern technology, robotics, and lots of large surgical teams taking care of patients, which is how we largely perform surgery today. 1 floor above ground is our labor and delivery and our level 3 NICU. We have basically about a 15-bed NICU. It is Level 3, which is aside from the main, children's hospitals, the CHOPS and the Nemours, it is the highest level of care for babies, and it's a fabulous unit. It also has a lot of light. It looks out onto a green roof. It's very healing. Typically babies in the NICU are in there for an average of, a month or so. So having that kind of environment for babies and for families is just a real improvement. Above the first floor is a 25-bed maternity unit. Above that is our new intensive care unit, truly also a major improvement in terms of space. It has family space and staff space and patient space. Again, not lots of natural light. 2 floors above the ICUs are basically surgical floors. We call them acuity adaptable. So as healthcare evolves and changes, the rooms can really be adapted for all kinds of clinical the future of clinical care, but right now we're using them largely for surgery. So they're equipped with rehab facilities on each of those floors so patients can begin their rehab, particularly orthopedic patients, while they're hospitalized. Both of those floors have what we call a concierge suite. They're essentially two patient rooms adjoined, an anteroom for families and a patient room. And they're just nice to have, particularly for very critically ill patients and families who request that kind of upgrade, and they are now available. Just a couple of quick views. This is a rendering of what the new lobby looks like as you walk into the Warden lobby entrance. This is the new atrium. It's the J. Malin Buck family atrium. It's a 2-story facility. This is now where our surgery patients and surgery families wait in this large atrium space. We have food vending and coffee services available and food services available in this part of the new hospital. And the outside of the old building you can see is the brick to the left, which is part of the old building. For those of you who knew this area, this is Lindsay. We're basically Lindsay Avenue. It was a small road that sort of separated the campus. It's now, we enclose the road, and this walkway is basically an old, part of an old throughput that cars used to travel through. And the ORs are off to the right. This is a picture, a photo of an actual patient room. You're looking at it from as you walk into the room. There's the caregiver area of the room, the patient room, and as you can see behind the back of the room where the windows are is really the family, the sort of the family support space. And each of the rooms is private. They have their own bathrooms. Lots of scenario planning and simulations done with staff. And we had a patient advisory group help us work through the design and functions of these rooms. It's just a picture of the new, one of the bassinets in the new NICU. You can see how light and open it is. Very private also for families. Just a view of the recovery room, first stage recovery out of the ORs. Again, not often do you have windows in a recovery room, but you can see we provided natural light in the recovery room, again, important for patients as they're kind of coming out of anesthesia and kind of getting reoriented. We've done a bunch of social media marketing, and it must be working because the hospital at this time of year is especially busy. The ERs is very busy. The floors have been very, very busy. But it's really been a very positive, and we've gotten just great feedback from our families and our patients, and we're very proud of what we're able now to offer the community. Couple of quick highlights on just a couple of other programs. I just wanted to take an opportunity to give you, and I'm happy to see that Linda is going to, or somebody is going to be presenting the thrombectomy-capable accreditation that was just awarded at Bryn Mawr. But stroke care is undergoing a major evolution, and there is a lot more that we can do today for strokes. And we have assembled a really first-rate team of neurosurgeons in collaboration with our partners at Jefferson, and are now intervening and reversing what is possible during a 24 to 48 hour window for certain patients who are suffering from stroke. So they're opening up arteries in the brain through some very sophisticated technology and skill sets. And again, we have just been designated as one of the few thrombectomy-capable sites in the region. We have an outstanding breast cancer program. It's really been a leader in our health system for multi-specialty, comprehensive care. We see a lot of patients who have diagnosed and treated. We have a very, it's a great program with oncology, medical oncology, radiation, and breast surgery, and very specifically fellowship-trained breast surgeons and breast radiologists as well. Our nurse navigators and genetic counselors in that program are really critical and provide some great support to patients. Our orthopedic surgery program is busy in this new pavilion. It's where we see most of our patients in the OR and then on the upper floors. As I said, we are a training site for the Jefferson residents in orthopedic surgery. Very strong relationship with the Rothman Institute. Bariatric surgery, a relatively new program, but as bariatric care has become increasingly important as an alternative and as an adjunct to weight management for really extraordinary cases, the program has grown. We've just recruited our second bariatric surgeon. And again, the team is very comprehensive, as you can see, includes nurse practitioners, psychology support, exercise therapists, nutritional counseling, and the health system is going to be rolling out an additional medical weight management program, which is a great adjunct to this program. Our maternity program, again, is really, you know, there are not many people who, when you walk around, we hear a lot that, you know, I was born at Bryn Mawr Hospital. We hear that about generations of families, so we're very happy to be able to provide some new facilities. And we have a very close relationship with the Life Cycle Women Care, which is the birth center, which is not owned by Bryn Mawr Hospital, but it's across the street from the hospital, and it is just today, they run out of room because they only have a certain number of rooms and they have to deliver in a facility. We provide that kind of backup. And of course, for patients who are too complicated during a portion of their pregnancy to deliver in the facility, we have provided that care for them. So it's a great relationship, an important one. And pediatrics, lastly, we are one of the few health systems with children's hospitals that has a pediatric unit, and we're a busy unit in the winter. We're oversubscribed. See a lot of young kids with respiratory disease, and we have this relationship with Nemours, who's our pediatric partner. We are staffed 24/7 with hospitalists on the pediatric floor, and we have board-certified emergency trained pediatricians in our ER. So it's a great service, and we're very proud of it. And that is my report. I'm happy to take questions, Linda, but
thank you. That was incredible. Thank you so much for telling us more about Bryn Mawr Hospital and all the great things.
Right.
Any questions?
I just have a comment.
Yeah.
I was in that pavilion about 3 or 4 weeks ago as a visitor, and I was really taken back by how beautiful it is. And I did note to my husband the amount of light, and I think that is so incredibly valuable to the welfare of patients. So I think guys did a great job.
Thank you very much. And we've really started to think more and more about complementary care. So we're offering and providing Reiki therapy, massage therapy, healing hands. I mean, it's just we're really thinking much more broadly today about taking care of patients and families and what that feels and looks like. And certainly some of the design issues were clearly thought through in that regard. So I'm glad you felt that way. Thank you. Thank you.
I'm going to do a quick presentation on stroke because it's Stroke Awareness Month. Yeah. Oh, there it is. Okay. Okay, there we go. Okay, so we are in stroke month, so I thought it'd be apropos to talk a little bit about stroke. I just have a few slides. Okay, so statistically in the United States, every 40 seconds someone has a stroke. And about 55,000 more women than men have strokes each year. It's the fifth cause of death in the United States, and 1 in 4 strokes are people who have had a prior stroke. And statistically, 80% of all strokes can be prevented. So if we think of strokes overall between a bleeding stroke, which is a hemorrhagic, and an acute ischemic strokes, which are caused by a blood clot, account for 87% of all strokes. And the remaining 13% are hemorrhagic. But of those 87%, there's things we can do. Okay, so for the public, there's an important acronym. So if you're out with your friends, family, that sort of thing, or you see somebody that might be having a possible stroke, you want to think of stroke as an emergency, obviously, but every minute counts. So we want to think about ACT FAST, and FAST, F-A-S-T, is an acronym that you can easily remember and the public can remember to identify a possible stroke. So F for face, does one side of the face droop? Ask the person to smile so you can determine whether or not they have symmetry or maybe a droop on one side. A for arms, is one arm weak or numb? Ask the person to raise both arms, and does one arm drift down or not? So that might be an indication. S for speech, is the speech slurred? Ask the person to repeat a simple sentence, and is the sentence repeated back to you correctly? And then T for time, if the person shows any of these signs and symptoms, you want to call 911 right away and get them to the hospital. So have the ambulance go to the nearest certified stroke center. So we're in a great area right here because we're all certified. We have Lankenau, Bryn Mawr, Riddle, and Paoli as stroke certified centers. Okay, so how do we take care of people that are having a clot-related stroke or an acute ischemic stroke? The clot-busting drug called Activase or Alteplase, which is TPA, we can give it up to 4.5 hours after the onset of symptoms for an acute ischemic stroke. So it's the only drug that is indicated or can be used for acute ischemic stroke. The other change we can do is the ability to provide treatment for wake-up strokes. So we can provide treatment if you were last known well within 24 hours. So oftentimes in the past, we've had people coming into the emergency department or physician's offices after they wake up after sleeping all night, and we have no idea when they started to have their symptoms. So the clot-busting drug, Alteplase, is not able to be given outside that 4.5 hour window. So at this point, you could come in and have your clot removed from your cerebral artery through a thrombectomy-capable intervention, meaning they can thread a wire up and retrieve the clot and resume blood flow and avert any prolonged or detrimental effects of the stroke. So here at Mainline Health, we have certifications, as I mentioned. We have Lankenau Medical Center, Paoli Hospital, and Riddle Hospital. And as Andy mentioned, Bryn Mawr Hospital became a thrombectomy-capable center as of January of this year. So the thrombectomy-capable stroke center, pre-hospital providers, so if they think they're having a large vessel occlusion, meaning acute ischemic or a big clot, they will divert that ambulance over to Bryn Mawr Hospital to have this procedure, and then we get from Riddle, Lankenau, and Paoli, we can have the patient transported down to Bryn Mawr Hospital for a thrombectomy intervention. So EMS people will know, and then there's specific criteria that the state put out that they can do a specific scale in the field at home or wherever they pick up the patient, and if they have an indication of a large vessel occlusion, they'll immediately bring those patients right to Bryn Mawr Hospital. And we've seen great outcomes. This is a picture of the Bryn Mawr Hospital Neurointerventional Suite. So they're open and available 24 hours a day, 200 and all throughout the year. Okay, so watching the clock. So this is just something to keep in mind. So the American Heart Association news, so 0 minutes, onset of stroke symptoms. within 3.5 to 4 hours, clot-dissolving drugs, alteplase for mild and severe strokes, and within 6 to 24 hours, mechanical thrombectomy with stent retrievers and large vessel clots. And what's nice is even if we give the alteplase in the emergency department and they're up in ICU and don't resolve their stroke-like symptoms, they still can go up and have the stent or the clot removed up to 24 hours. All right, and that's it. Any questions? Yes.
Thanks. Two questions. Why is there a 4.5-hour window and before the alteplase can be given? And also, when they present, do they give that regardless before they've determined whether it's ischemic versus an occlusion?
That's a great question. So we have processes built in place in the emergency department and throughout the hospital. We call something called a fast alert, and the patient would be taken right over to a non-contrast head CT and get a perfusion scan, and then the neurologist would make that decision to give the alteplase. Obviously, you want to rule out for any head bleeds first before giving any kind of clot-busting drugs like that. So the physician, whoever it is, and the neurologist would be consulted to see that. Does that answer your question? All right. All right. Any other questions? All right. Thank you very much. Okay, so we're going to move to public participation. So I know we're jumping around a little bit with the agenda. Thank you again, Andy. If you don't mind just telling us your name and...
Sure. Yep.
where
I'm
you
Gail Morrison, 111 Poplar Avenue, Wayne, PA. This is my daughter, Danby. Just came up here. So I am one of the founders of Radnor Residents for Gun Safety. We formed in the wake of Parkland last March. You may be familiar with what we've been doing with Chief Flanagan. We bought gun locks for the Radnor Police Department. Chief Flanagan he mailed every pediatrician in town to say, please be aware that we have gun locks. Please speak to your patients about gun safety and gun access laws. So my being here tonight, in hindsight, I should have called Marie on the phone to go over the process. And we just were all emailing since April about handing out the gun locks and your mental health. I think you had a suicide prevention report recently, or it's coming. So we said, now's the time to get in front of the Board of Health during public comment and make sure we're talking about our efforts and both the gun lock availability, the gun and ammunition turn-in awareness is 24/7 in Radnor. People can call the Radnor police and say, you know, I found this gun in a drawer, I don't even know if it works, that aspect. But also very, very importantly, there is pending legislation in Harrisburg for an Extreme Risk Protection Order bill, ERPO it's called. It's a red flag bill if you've heard about it. Members of our group are very involved with Moms Demand Action. They've gone to Harrisburg many times about this bill. It's Senate Bill 90 and House Bill 1075. It's somewhat stalled right now. So any efforts by any of you, by anybody in the state of Pennsylvania is really important. I'm going to read to you. So I just kind of want to recap. You know, we had the Wawa shooting April 28th. Kat Copeland, the district attorney in Delaware County, had a press conference I attended where she said we don't really know what was in the shooter's mind, but that's an instance where his ex-wife, his family, there were lots of red flags and lots of concern, and this man was able to buy an AR-15 and use it to kill his wife in cold blood in our town on Sugartown Road. And if this law were in place, that could have changed that. So I want all of you to think about that. We had an 18-year-old boy from Radnor High School and an 18-year-old boy from Conestoga High School working in that Wawa that night. They witnessed that. That's, you know, and then since then, there was the school shooting in Colorado. Those boys, the two kids, accessed their weapons in their home from their parents. That's at least 2/3 of the time, that's where school shooters get their guns. They're not locked in their home. So we're all not doing enough about gun violence, okay? The ERPO law applies to anybody who wants to harm themselves or others. So 2/3 of gun deaths every year in the United States, about 22,000, are suicide. There are, probably you all know that they have family members who are devastated after their loss. They have family members who probably had an idea that they could harm themselves. Suicide by gun is lethal over 90% of the time. So means matter. That's something we talk an awful lot about. I don't think I need to kind of run through the stats. Do you all have any questions for me? I've gone on.
I just want to clarify something. So if they have a gun turn-in or ammunition turn-in, they call the police, or can they drop it off 24 at the window?
They should pull up,
Okay.
as Chief Flanagan has told us, and maybe you can help too, but
Okay.
they should pull up and just let the police know they have it in the car.
Okay.
So they shouldn't walk in with their guns.
They shouldn't walk in with it?
unannounced.
Okay.
Yeah.
Yeah, okay. And the gun locks are available still in the window at the box?
Yes, and
Okay.
every officer has them in their cars.
Okay.
We gave them out at Wheels of Wayne yesterday, so we table at community events. And any of you, if you know of any other community events where you would like Be Smart to be there to present people who are trained in the SMART protocol for educating people, I think one of the most important parts of that, it's all important, but model responsible behavior is the M in Be Smart. And that's about don't play with guns. Don't photograph yourself with guns. The guns are not toys. All of these things. And really the focus of Be Smart as well is it's not up to a child to realize not to touch a gun. Curious toddlers, you can't tell them, oh, don't touch that. So it's the parents' responsibility to lock their guns, to keep ammunition separate, and ideally not have guns in the home because people are a lot more likely to be injured or killed with a gun in your house.
Go ahead.
Thanks. You're doing good work. That's
Oh,
great.
thank you.
How long have the gun locks been available, and how many homes have taken advantage of that?
Oh, that we would have to add. The very first, during last October's Active Shooter Symposium, that's a little bit more of what I'll mention. Side note, Chief Flanagan said, we've been doing so much work to work more closely with the schools to prevent these shootings. And we sort of had a very first night of that, and they took, in a 2-hour window, 6 guns and 1,000 rounds of ammunition. I don't know otherwise how many guns or gun locks have been given out. But they also, anybody who, say a doctor's office says, I received your letter and I don't have locks, they'll come drop them off. They'll bring them as many as they need. And I think I started to say that, if you know of any other community events, Lauren Williams from our group and another gal named Sarah Wallace are both trained in Be Smart. They live here. And we can always garner resources. The gal who came to Wheels of Wayne is from media, but moms demand action on gun senses, so it's their duty to make sure people are trained in that and they're out whenever anyone asks.
Are there statistics available on the percentage of homes that have kids and guns that already have gun locks?
That already have gun locks.
That use them. Yeah, do we know?
I don't know. The only number I have heard is that at least 5 million children live in a home with an unsecured gun. And, like we talked about, we've had 4 murder-suicides in Radnor in our township in the last 3 years, is it? The one that affected a 14-year-old boy affected parents greatly. I came in with a head of steam about talking about this because it's a very emotional issue. So I apologize for being a little worked up when I started.
So we all are so grateful for you being here. What else can we do as a board to support you? Can you give us some feedback about what it is we can do better to help support the safety of our children in the community?
Yeah, we're, this is kind of getting in the weeds, but we want to provide literature boxes for every doctor's office that we've contacted so that there's Be Smart brochures and gun locks in their offices for any parent to take. And the way we got a source to get the gun locks, and Radnor parents chipped in $950 to buy them from Scott Charles, who works at Temple University Hospital in their Cradle to Grave gun violence prevention program citywide. So I kind of lost my train of thought there, but he talks about the importance of education, awareness, and when he gives out gun locks, he says, no questions asked. If you want one, you can have it. So I guess all of you, it's a cultural change, right? So every time you take your child to the doctor, did they ask you about guns in your home the way they asked about bike helmets and car seats? So we want it to be, that's when you get more awareness and more people talking about it.
Have you?
Go ahead.
I'm sorry, Linda. I was going to just ask if you've been able to have a chance to look at our website, if we have any opportunity to add additional.
For BOH?
Yes.
Yeah, I will do that. We cannot say enough good things about Chief Flanagan, because this is a change for law enforcement. There was a time that it felt too political and they didn't want to talk about it, but he has been so encouraging, and his community relations model where he will talk to anybody and he realizes the importance of this. He did the YouTube show where Lauren and Sarah went and talked to him about Be Smart and about the gun locks. So he's just been very forward-thinking and very kind and very community-oriented about this program. So I say that because there are links to the YouTube on the police web page. There's links to Be Smart and the program materials for that. But I will definitely go ahead, and so I can just send that to Marie, and then you guys can get that for the
So
Board of
Gail,
Health.
thank you so much for bringing up a very important topic and something that really does pertain to the public as and our children, most especially. So maybe we could do some brainstorming offline and see if we can touch
Sure,
base with some of the
yeah.
pediatric offices, and we
That'd
talked
be
a lot
great.
about the
Yeah,
hospitals.
Social workers,
So
behavioral health, the red flags. If we could marshal all the resources in the state to urge the legislature to get, because Governor Wolf has said he'll sign the red flag bill, the ERPO bill, but it's stuck in political bickering in Harrisburg, in the two houses of the legislature. So, and a part of the thing that comes up with us is our local reps to Harrisburg have been on board the whole time, but other parts of the state don't have the same either level of awareness, or there's fear around ERPO that there's not enough due process. But Representative Todd Stevens is a Republican from Montgomery County, Lansdale area. He's the sponsor of the bill, and he's been doing a lot of work with the ACLU and with the chiefs of police, because that bill is a really big deal. That will save lives. And I do have in here, in Connecticut passed a red flag law. They saw a 14% reduction in firearm suicide. Indiana passed one, 7.5% reduction in firearm suicide. 1,000 Pennsylvanians every year kill themselves with a gun. So people could be saved.
How do Radnor residents access the law if they want to review it?
You can pull
Potential proposed.
The HB 1075. If I wish Roberta was here, because there's a
It's probably up there. Yeah, it's probably in the, yeah.
legis.state.us or what.
Linda, why don't we suggest we just pull it and take a look at it and see if we can
Yeah.
make a
Yeah,
yeah,
recommendation?
definitely, we can look at that next month for sure. And
That'd
then
be
if you
great,
need
yeah.
us to do some kind of proposal or letter of support, we'd be happy to draft
That'd be
something.
super,
I
yeah.
second that. I'm in agreement.
We're all in groups, regional groups in all of Southeast PA, so if you do one, we can give it, and if people bring it to their boards of health too, and they can replicate it. So,
Great, so if you want to give Marie your email address, and then we can correspond
Sure.
via email and follow up, and we'll definitely put it on the agenda for next month, because we do have, Dr. Carabassi has a speaker coming in for mental health awareness next month.
Yes, that's it, and that's where I think we got the wires crossed, that I thought that was tonight. Sorry. Okay, all right, thank you.
Thank you. Okay. All right, did we want to have the health office, should we go through the agenda, Marie? Would that be, because we are about 10 minutes tops, probably?
Could the board review the minutes?
Yes, that would be great. So did everybody get a chance to look at the April 8th meeting minutes? Okay, does everybody approve? Do I hear a motion to approve? Okay, great, thank you. So, meeting minutes from April 8th, 2019 approved, and they are posted on the website, or will be, correct? All right, so the gas leaf blower recommendation is going to be presented tonight. Board
It
of
is on the
Commissioners?
agenda.
On the agenda, so it's last, so we did give a proposal for that, so we'll hear more to come on that. The vaccine policy, so Marie, did you send out the vaccine policy which mimics the state, Pennsylvania state immunization requirements, correct?
I believe I sent out the Radnor School District guidelines, but they are based on the state guidelines.
Mimic the same PA state guidelines for vaccinations. I think it's referenced even on the Radnor Township website.
Any update on the West Nile surveillance program? I know that went live May 1st, correct?
It was confirmed that all positions were filled.
Oh, great.
And everything should go on as planned. I spoke to somebody in Intercommunity Health Coordination, I guess about 2 weeks ago, and the DEP was scheduled to come in early May to train those who just took over those positions.
That's great news, because I know we had a lot of concern about that, and I'm really pleasantly surprised it got filled so quickly. So, all right, Wheels of Wayne, just a follow-up.
Maria and I were sitting at the table yesterday. The gun locks were probably the hottest item going. I have no idea how many were picked up yesterday, but they were very much of interest. And even people would pick up, what is this thing? Oh, well, I don't have any guns. Or, okay, thank you. We also had quite a bit of information about various programs, including the survey of suicide prevention resources. That was an interesting one. We had a number of people who came by, looked at it, and decided not to pick it up. And my sense was they were embarrassed. And I don't know how we deal with overcoming the embarrassment of, or whatever it is. But Marie, did you get that same vibe yesterday?
I think so. I found myself asking if they had students in the district and if they would be interested in it, and not everybody was interested in taking it or reading it.
Yeah, most of the people who picked it up probably weren't the ones who needed it most.
Well, thank you so much for going. That was great, and it was a beautiful day, so I hope
Yes,
it was a gorgeous day. So thank you so much for our representation there at the Wheels of Wayne. Thank you so much. Just to mention, the delayed school start time here in Radnor for Radnor High Schools was passed, so that was exciting news. So starting next fall, there'll be a 1 hour time delay for the start of school. I don't know what our interns think of that. Are you excited? They're excited.
Are you done? Are you seniors?
No.
Oh, okay,
No. Okay, so that'll begin next fall. And I gave a shout out to the former chair of the Board of Health, Dr. Foreman, and Dr. Schwartz-Hopko for writing that proposal back in 2017. It was supported by the CDC, the American Academy of Pediatrics, and the AMA. And Radnor Township High School was the first high school in southeastern Pennsylvania to pass this, so well ahead there. And then school's going to end 45 minutes earlier, correct? Is that what you understand? Or later, excuse me, 45, sorry. Yeah, 45 minutes later. So it'll start an hour later and 45 minutes later. So it'd be interesting to see the metrics and outcomes for that. So that's great news. Vaping in restaurants. I don't know if we have a minute to talk to that.
Does somebody want to talk about it?
Yeah, Marie and I were talking offline about.
I think we were
gonna
waiting to
follow
hear
up on
from
that?
Superintendent Flanagan. He was going to look into the law enforcement side of that because the I think we discussed that the Clean Indoor Air Act did not
Correct.
cover vaping because it wasn't popular at the time that the bill was written, so.
Yeah, I think that was back in 2008 from what I can see there.
Are there state law that governs any of that?
Thank you, Marie, for finding that Clean Indoor Air Act. So that was a good start. So we're going to see what we can do in terms of ordinances, that sort of thing about vaping in restaurants and public areas. I also wanted to give a shout out to Marie for providing AED and CPR training to the members of Proclamation Presbyterian Church last month. So thank you very much. I wanted to touch upon measles. So we did send some information out about measles. So let me just grab that. Mumps and measles has been so I don't know if the public's been aware, but there's been 5 cases of measles in Allegheny County, I guess up a few weeks ago. Those people are being followed up on. But there's been ongoing outbreaks in New York, New Jersey, Michigan, California, and many other countries in Europe, Asia, Africa, and South America. So they're saying to, if you suspect it, to keep in mind that you have a febrile rash, cough, runny nose, water eyes. So really it takes between incubation periods anywhere from 7 to 21 days, usually onsets within 14 days. So the public should know that anyone born between 1957 who has not received 2 doses of the live measles-containing vaccine, or MMR, mumps, measles, and rubella, which would include infants too young to have been immunized, persons who are vaccinated with an inactive vaccine. So those folks before 1957, if you were exposed to somebody, would follow up with your healthcare provider because you could get a booster shot of the measles vaccine. Those that were used between 1963 and 1967 and have not been revaccinated should also follow up with their healthcare provider. So, and also those that did not receive the vaccine, whose immune system are compromised, would be at risk. So you want to follow up with your healthcare provider. So if you come in contact, we heard about the cruise ship, and they were quarantined on that cruise ship, I guess in the Caribbean somewhere, and they got extra doses of measles vaccine at that point. So if you have any questions, follow up with your physician provider. Any questions?
Just one question, Linda. Do we have a sense of what the vulnerable population is, as the majority of these cases are associated with children that were not vaccinated? Do we have any sense from the school about the scope and scale of the potential? Because the majority of these are going to be kids that didn't get vaccinated for whatever reason.
So are you asking to clarify how many kids are unvaccinated in the school? No, I have no idea.
Yeah.
I don't have a number of how many are unvaccinated. Those kids are excluded when there's a case.
I thought the majority of the cases were in kids that were unvaccinated. Am I?
There's also some cases, I don't know if it's these cases, where they're babies and they just aren't old enough to get the vaccine.
Mm-hmm.
They're not at the right age. I don't know if it's these 5, though. I don't know about that.
I'm just asking. I don't know the answer. Do we have any role at all, this board, in adding education at all? I don't know the answer, honestly. I mean, it's just such a big issue. It's all over the media. It's scaring a lot of folks.
I think you're spot on that the outbreaks have occurred in areas of low density of vaccination. And I think you have to keep in mind the difference between a policy that says if there is an outbreak, you would exclude people who are unvaccinated from coming to the facility, and what we can do to enhance the probability that the level of vaccination in our community is adequate to prevent our community from being one of those communities. And I think it's probably beyond the capacity of our discussion tonight, because right now it is driven by state law. I don't think we have local ordinance or the capacity to pass local ordinance, and it, to my ability to discern based on what I'm reading, College campuses are a likely place for outbreaks, mumps and measles, and Radnor School District does not drive policy at the various college campuses in the community. So I think we should consider what we can do, but for the moment and for tonight, I don't see a clear path. And I was intending to actually sit down with Marie and with Linda and perhaps with Lisa and have a discussion as to whether we do have a role. If we don't have a role, let's not waste our time. But if we do have an opportunity to prevent ours from being a community that shows up on the map as a big red spot, I think we should.
I mean, Andy, you miss Dr. Foreman, here and getting his thoughts on this would be great. And obviously, all of us being still close to him, I think that's, we should use him as a resource.
We could always ask him.
Yeah, use him as a resource as to what.
He could be our guest speaker next month.
I think it would be
that's a good
great.
idea.
I'm sure he'd be happy to come back.
Okay, so maybe we could take this offline and have some further discussion. So I'd be happy to take a closer look at this. And for time's sake, we'll have to move on. There is a House bill right now looking at, and this is, we'll talk about this also, about, providers, where was it? Sorry. So healthcare practitioner or facility would not be permitted to refuse to treat a child whose parent has chosen to delay or decline one or more vaccines. So this is a bill right now that was introduced in Pennsylvania, House Bill 286. So we can talk more about that as well. All right, so I think for the time purposes, we're going to finish up. And just to know, we're going to have our student intern presentations next month. Thank you very much, Phil and Lewis. And mental health awareness.
There are a few questions that I have, but maybe we can just discuss it after the meeting. Start time, how long, who will be invited, and I also talked to Dr. Winterstein about the content. So if you have a couple minutes after the meeting, we could quickly go over it. Okay?
Definitely, thank you. All right, our next meeting is scheduled for Monday, June 17th at 5:30 here. So I'll adjourn. Yes. Yes, sorry.
There's another board meeting coming in.
We're talking very fast.
Sarah Pilling from Garrett Avenue. I wanted to let the Board of Health know that the Ready for 100 Green Teams meeting is next Thursday at 6:30. It will be in this room, so it will be recorded. So because public health is such a large component of our Ready for 100 resolution, at a minimum, watch it on YouTube the next day. Jim Wiley is going to give us an outline of how to make the steps forward. And the main reason I came tonight was because you were going to discuss expanding Radnor's composting program. When are you going to do that? Because I'm very interested for both health and climate change. It seems to be on your
I see it on the agenda. I see it on here, and I apologize. So I think, Marie, did you send me something related to the composting program?
I did. There was a resident who emailed and had wanted to talk about that, so you had put it on the agenda. But they didn't come.
Can we keep it on
They
the
didn't come.
agenda?
100%,
sometime
and
in
I
the
really
future?
apologize. So can we table that for next
Yeah,
month?
It's just very important for climate change.
Okay.
Thank you.
Thank you so much. All right. Any other participation comments? All right, meeting's adjourned.